Good afternoon. My name is Jennifer Coleman, and I'm doing a presentation titled CenterWell Home Health, Patient-Centered with Quality Care. This is in class Operations and Quality Management of Healthcare, and the instructor is Dr. Brad Bouveau. CenterWell Home Health offers an umbrella of services available when a prescriber recognizes the need for this type of service. Within the structure of my paper, this was evaluating and defining how structured, evidence-based, attention-driven, core beliefs, and progressive development of the organization has become since becoming acquired by Humana, its parent company. Within the home, there are a variety of therapies, nursing skill sets, social work support, and ongoing community support that may be offered to aid the patient and caregiver to the best possible outcome for the diagnoses that are being treated. Each specialty offers an impactful opportunity to the customer's service that best suits the patient needs, abilities, knowledge, and understanding, as well as achieving the highest rate of return for the patient. As an organization that is now considered a top-tier performer, Humana assumed CenterWell in March of 2021. As a young subcategory of Humana, CenterWell has made a name for itself with high-quality, evidence-based care. Centers for Medicare and Medicaid Services stress to be better, smarter, and healthier on behalf of our patients with continued support.
Nursing in the home setting is very unique. It is very patient-centered, just as it would be in the acute care in an outpatient office. It is very focused perspective because we're there for a specific condition that we're teaching and educating on, but we also have to be very flexible when it comes to management of that patient. This clinician that's in there has to be flexible to adapt to anything that's happening with the resources that are actually on hand in the home or on the person themselves. It's similar concept to like remote access or rural care. You have very minimal resources within yourself or in your belongings, so you have to be able to navigate quickly in a critical thinking dynamic. CenterWell is a new era of home health care. It navigates understanding how debilitating the patient's comorbidities are, in addition to elevating the patient's quality of life. When they're diagnosed with the condition, the diagnosis can change over time. However, it still may evolve and require avoiding exacerbating factors to remain in remission so that the patient is not necessarily just diet controlled with history. It allows them to be better controlled long term. In September of 2022, that's when they launched CenterWell to be able to go across the country. When the patient receives a diagnosis, it's very overwhelming. CenterWell's objective is to be able to establish an effective communication so the patient understands longevity and how to navigate that care. CenterWell has multiple mediums to be able to measure success. The American Healthcare Association and National Center for Assisted Living has certain criteria that can judge and award an organization for high quality care. Centers for Medicare and Medicaid Services, which is CMS, they use a star rating, and star ratings of 4.5 to 5 actually get increased bonuses when they do reevaluations every 3 years. And then the 2024 Strategic Healthcare Program, the SHPBEST, in conjunction with Home Healthcare Association assessment of healthcare provider services, they also do monetary reimbursements to high quality care providers. So what is the driving force when it comes to improvement? So CenterWell as a whole uses something called the Outcome and Assessment Information Set, which is the USAHS questions. These are something that you collect on admission, which is considered a start of care. And that is where you evaluate, and it reports as the patient gets treatment across the course of the term. That patient ends up getting evaluated ongoing. That it's also used in conjunction with CMS, and then CMS reports with the USAHS, and that gets modified about every 3 years. They make changes to the USAHS questions to best suit as patient dynamics and change and requirements are changed. Then they make adjustments to the questions to be to fit the situation much better. So once the reevaluation is done, they change the questions. It aligns again with those demographic needs regionally and nationally. So with that, it makes sure that the best practice is actually being performed. Accreditation standards also end up doing the frequent reassessments to make sure changes in the policies are identified and transitioned towards improving the outcomes with our education that we're actually providing to the patient. Because ultimately, the information that we're portraying to the patient needs to be effective, and it needs to be current with current practice and not just something that was done from 10 years prior. So medicine, again, is not a uniform process. Healthcare is a process that must be tailored for that individual to improve an outcome. At CenterWell, the one thing I enjoy is the fact that the patient is the focus of the care. The team that's surrounding the patient, again, modifies any changes and accommodates any limitations that the patient or the caregiver may actually have. So how does CenterWell's reach the ability to be able to say, yes, we're successful? So we have to have an effective collaboration that fosters overall quality and process improvement. If we tailor those needs regionally, because if you look across the United States, certain areas of the United States actually have more comorbidities than other areas. So like in the South, perhaps we may have a higher incidence of kidney disease or blood pressure issues, because when you really look at when it comes to diet, what's down here? Most of your patients are drinking a lot of sweet tea. Most of them eat out. Doesn't mean they're not eating out in other areas of the country, but if that's a high prevalence in this area, we have to make sure that we're accommodating those comorbidities and addressing them more frequently. Also, we have to make sure that we're tailoring this to the patient's health, their goals, their belief, and their values, because ultimately respecting the patient's beliefs and practice is going to be a way for us to incorporate more compliance long term. Because if a patient just thinks you're doing this just because you're coming into their home and making the suggestion, but you're not making sure that it's going to be something that they can do long term, ultimately the patient's not going to be able to comply. As a whole, CenterWell has an option to be able to collect as many patients with a variety of different types of insurances. They collect everything from Medicare, private pay, managed care options, as well as preferred provider organization, which is PPO plans. Each plan has options to cover what best suits the patient in addition to allowable amounts. CenterWell does have to get continuing ongoing approval with what we call a start of care, which is how they initiate the plan of care. Anytime any modifications need to happen, they have to reach out to the provider or practitioner to end up requesting changes to that proposed original plan of care. Depending on the insurance, depends on how much agreeable amounts that the policy will allow, and then we just have to petition the insurance company for additional care. So CenterWell does use something called key performance indicators to periodically review and determine whether the organization is meeting the required goals with both within the company and the patient. So these are quantifiable measures that the organization can measure to see where we're at and our milestones actually being met, which is nice because as you have an opportunity to review and evaluate when the goals are being met, it gives you an opportunity to see where the improvement is, whether that's within the patient management or whether that's clinical based management. I have actually used this KPI picture in multiple of my platforms now because to me, when it comes to the fluidity across the board of this is one of the most accurate depictions of what a KPI can do when it comes to using home health scheduling in conjunction with employee use. So when it comes to quality reporting, CMS is summed up in these three words: better, smarter, and healthier. When it comes to home health, you want to establish your goals, you want to devise those strategies collaboratively, follow your guidelines because CMS is so strict with their guidelines. You have to involve your patient and caregiver in decision making, and you're going to continually readjust your plan of care. When you start to see the patients are having problems, their struggles, they're not able to get their medication, when it comes to whatever the case may be, you have to make modifications and make adjustments and then reach out to the providers to let them know. Again, effective communication between the patient, caregiver, and practitioner allows these patients to stay in the outpatient setting, which is the ultimate goal of our organization. Ultimately, CMS has quality strategy goals that they're trying to do. They're trying to reduce the harm by improving the culture of safety within the patient care. So we want to take away anything that's unnecessary. We want to prevent and minimize as much harm that can happen to the patient. We want to be involving the patients and their partners in their care as much as possible. You have to make sure there's effective communication and coordination of care both within the patient and the provider dynamic. You have to make sure you're preventively treating any chronic disease with thorough education, and you want to work within the community to help keep the patient in the outpatient setting. And if you don't end up making sure that the patient care is affordable, that they can comply even after separating from the home health organization, they're not going to be able to participate long term. So when it comes to home health process measures, they include things like timely initiation of care. You only have so many days from the actual order of to start the care to see the patient, or else it's a delay of care. You want to make sure that these patients have received their flu shots if we're in flu season. If they didn't receive it, we want to make sure they're offered, and then we document if they're refusing to get them. You also need to document if it's contraindicated to receive the flu shot. Considerations too when it comes to like your drug regimen. You want to make sure that they're being followed up with that provider, so that if you're having problems with the medication and they're not being compliant, you have let the provider know so that there's no delays in care for that. You also want to make sure that the information is being transferred to the patient and the caregiver in addition to the provider. If the provider does not understand that there's something happening in the home, ultimately that falls in the responsibility of the clinician that's there at the home. And if the patient is in receiving COVID-19 vaccinations, we just want to see who's up to date at this point. Because to date, some patients may have received the COVID vaccine back in the beginning, but they've not received any of the boosters, and we need to make sure we're documenting that appropriately. When it comes to awards and recognition, CenterWell has such a focus on that patient opinion with the financial returns because of compliance and improvement processes. Strategic Healthcare Program coordinates with home healthcare consumer assessment of healthcare providers and systems. They acknowledge that home health agencies have to have consistently providing high quality care to the patient. Based on those occurrences, it actually allows them to increase the amount of return over periods of time. In 2024, CenterWell as a whole received the SHP Best HCAPS Award. The local branch actually was in the top 20% for 2024, and our private pharmacy agency actually at 7 of the last 8 years was able to accomplish high scores as far as the superior providing care. CenterWell offers a very focused methodology when it comes to providing care. What they're able to do, we encourage that hands-on approach with patient-caregiver relationship. We also want to progress, like I said before, towards that independence, and we want to give people a realistic approach to their quality of life. If you don't have that realistic conversation, the patients are going to end up struggling because they don't understand why they can't get back to their baseline. So once the clinicians within the home, they provide the care, often that is the easiest part of the duration of the care. Patient and caregivers, they're thoroughly educated throughout the process, but once the patient is encouraged to get better, they have that independence, they improve that quality of life, their dynamics can change because they can see the light at the end of the tunnel. So when it comes to overall, health is a quiet subcategory of nursing that should be recognized for the challenging limitation specialty that it is. Little resources, remote care, unconventional environments, uncontrollable factors, and unpredictable dynamics impede care at every turn. This specialty has a way of bringing true educators to the forefront, as so much of the job is education driven. The reduction in exacerbating symptoms demonstrates the measure of success since the initiation of care. When a patient truly improves or does not regress, this shows how well the clinicians perform the necessary skills taught. By upholding the highest standards with each therapist or clinician, CenterWell demonstrates to accreditation agencies how far patients progress through the duration of care. In closing, supportive care comes in many forms. CenterWell has passionate healthcare professionals willing to commit time to patients and caregivers to achieve the best possible outcomes. As a nation, insurance companies have clearly established guidelines and strict accountability driven by frequent audits. CenterWell's precise measure of success is undeniable. Leadership in nursing and strong connections for providers facilitate easier transitions of care and supporting that patient throughout difficult times and providing patient-centered care. Compassionate care paved the way for a triumphant return to the independent living of home. I have thoroughly enjoyed this entire semester going through this process with CenterWell. I went into this thinking this was just going to be a new job and I would just kind of go, and I didn't realize how much I would love how much this organization cares about their patients. So I appreciate all of the opportunities that I have had to go through and be supported while I explored this subject. Thank you so much.